Evidence-based practice. What is evidence-based practice? Evidence-based practice is the integration of best research evidence with clinical expertise and patient values, which when applied by practitioners will ultimately lead to improved patient care. There are three fundamental components of evidence-based practice, and the evidence-based practice usually found in clinically relevant research that has been conducted using sound methodology. And whenever we are doing some procedures or some new intervention in the clinical, always we seek for evidence. Here the clinical expertise refers to the clinician's accumulated education, experience and clinical skills, and the patient values, which are the unique preferences, concerns and expectations each patient brings to a clinical encounter. Here you can see the three components: individual clinical expertise, best external evidence, patient values and expectations. Purposes of evidence-based practice: formulate a clear clinical question from a patient's problem, and we can search the relevant literature and then evaluate the evidence for its validity and usefulness, and finally we will implement useful findings in clinical practice. Better patient outcomes and the contribution to the science of nursing, and keeping practice current and relevant, and increase confidence in decision making. The 5 steps. First, formulate an answerable question. This is a fundamental skills required for evidence-based practice is asking a well-built clinical questions. By formulating an answerable question, you to focus your efforts specifically on what matters. Second, find the best available evidence. This is the second step. This step involves identifying search terms which will be found in your carefully constructed question from step 1. Third, appraise the evidence. It is important to be skilled in clinical appraisal, so we can further filter out the studies and use a simple critical appraisal method that will answer the questions. Fourth, implement the evidence. So finally we will be implementing the evidence. So here individual clinical decision can then be made by combining the best available evidence with the clinical expertise and the patient values, and this clinical decision should then be implemented in the practice, which can thus justified as evidence based. Evaluate the outcome. This is the final step in the process, is to evaluate the effectiveness and efficacy of the decision and direct related to the researcher. Here you will search for new information. Should the new information continue to be applied to practice? So that's what will be done in the evaluating the outcome. These steps may be more memorable if remembered as ask, acquire, apprise, apply, audit. In 2010, Mellink et al. Proposed adding 2 other steps to the process. Step 0, cultivate a spirit of inquiry. Without the spirit of inquiry, the next steps of the evidence-based practice are not likely to happen. So we will inquire for new information. And step 6, disseminate. Disseminate evidence-based practice results. Among ways to disseminate successful initiatives or evidence-based practice rounds in your institution, we can present it at local, regional, national conferences, even international conferences, peer-reviewed journals or professional newsletters and publications. The problems with evidence-based practice. The evidence-based practice quality mark has been misappropriated by vested interest. And sometimes even volume of evidence, especially clinical guidelines, has become unmanageable, and statistically significant benefit may be marginal in clinical practice. And even unflexible rules and technology driven prompts may produce care that is management driven rather than patient centered. So sometimes it may be management centered, it may be motive of some other thing, it will not be in the client oriented. And even evidence-based guidelines often map poorly to complex multi-morbidity. Thank you.